Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today is Dr. Jennifer Bowden, who is the Director of Research, Adjunct Instructor in Nutrition Dietetics and Food Science at Brigham Young University. And she will be discussing today the article for which she is the first author. And the title of that article is Using a Combination Amino Acid, Carbohydrate, and Micronutrient Beverage for Preoperative Nutrition Allows Safe Gastric Emptying for Anesthesia Provision in a Prospective Single Group Intervention. Welcome, Dr. Bowden.
Thank you so much. I appreciate the opportunity to speak with you.
Thank you. So my first question is, why is preoperative nutrition a critical element when we think about positive surgical outcomes and especially enhanced recovery?
So preoperative and perioperative nutrition is critical in surgery because our bodies need nutrients to heal. So when someone undergoes a surgical procedure, even a minimally invasive one, tissues are disrupted and damaged, and we need to provide the nutrients required for that healing process to occur. As we've learned more about surgery recovery over time, better protocols have been developed, particularly in programs like the Enhanced Recovery After Surgery or ERAS system. And one vital component of this is nutrition, as when we have adequate nutrition, we optimize healing and reduce complications. So several examples, we can decrease surgery-related hyperglycemia and insulin resistance. We decrease catabolism that occurs when the body robs protein stores from the muscles to use for energy or creating the critical inflammatory proteins associated with surgery. Better nutrition can help decrease pain and analgesic use. We decrease postoperative discomfort and improve postoperative gut motility when we're providing good nutrition before the surgery. Outside of the direct nutrient benefits are simply the benefits of making patients more comfortable. When people are allowed nutrition before surgery, their anxiety is decreased and patient satisfaction increases. No one wants to be in a stressful situation, which surgery inevitably is, and adding hunger and thirst on top of that just makes it worse. So if we can help alleviate some of that, then that's a real positive. The tricky part is that we also need to consider patient safety with anesthesia. Anesthesia has gotten better and safer, and that's a really positive thing, but we do also still need to make sure that the gut is empty. And unfortunately, we still have a common practice in many facilities of keeping patients NPO after midnight and encouraging fasting from solid foods even longer, despite research showing that patients can safely eat solid foods up to 8 hours before surgery and clear liquids up to 2 hours before surgery. So that NPO after midnight might be okay for those individuals who have a 7 a.m. surgery, but what about those who have a procedure at 5 p.m.? We're basically putting people in a catabolic state before a procedure that will then exacerbate that, rather than optimizing nutrition before the procedure, which I would hope is what we would all want to have happen. For the facilities that do follow these ERAS protocols and allow nutrition up to 2 hours before surgery, that nutrition is still being limited to simple carbohydrates. And so with this study, we're working to change that tradition by showing that other nutrients can also be included and safely clear the stomach before that 2-hour limit.
Thank you. Such important points and definitely related to outcomes and enhanced recovery. Thank you so much. My second question then is, what type of study design did you use to achieve your study results?
So the study design was pretty simple. We used a prospective group, single group intervention, and our participants were asked to come in first thing in the morning with an overnight fast of at least 6 hours so that we knew that their stomachs were empty to give us a baseline level. And then we used supine and right decubitus antral images with ultrasound to get baseline imaging for initial measurements and to ensure that visually that their stomachs were empty. We then asked them to drink 250 cc's of our study beverage within about 5 minutes, and then repeated the ultrasound to show the full volume in the stomach. And then we followed up with those same images every 30 minutes until their stomachs were visually empty. We also took cross-sectional area measurements to determine quantitative gastric volume at each time point. And because we also wanted to verify patient comfort and tolerance, we asked the participants to respond to tolerance questions at the end of each of those imaging time points.
Thank you. Very, very nice and detailed description. I appreciate that. My third question then relates to other supplements that may have been used in the past. Could you describe the supplement that you used in detail, and then how it's novel if we compare it to what might have been used in the past?
So primarily in the past, it's been a simple carbohydrate beverage, and most facilities have still continued to just recommend, if they do recommend clear liquids up till that 2-hour time point, to just, have some apple juice or drink some Gatorade. And that's giving us some simple sugar, but it's not giving us much of anything else that's going to be helpful for that surgery recovery process. And so for the supplement that we used, it's based on some extensive review of the literature to include nutrients best suited to a preoperative situation. So the main component that differs is that we're including 12 grams of amino acids in this to be able to give that benefit of the proteins that we need for surgery and recovery. So this supplement focused on the conditionally essential amino acids that are needed in a physiologically stressful situation. And then it also includes all of the essential amino acids. And because we've included those amino acids, the body has a preoperative protein source that's readily available rather than pulling away from muscle stores. And so we find that to be kind of a critical factor and was one of the main focuses for why we wanted to do this study. But we also wanted to take into consideration some of the other nutrients that are also important. And of course, carbohydrates are definitely important. But we used a combination of different carbohydrate forms that's been shown to improve gastric emptying rather than just using one type. So a combination of fructose and dextrose rather than one or the other seems to be helpful for that emptying process. So carbohydrates can be used for energy, which again preserves muscle stores. The micronutrients that we included were chosen specifically to aid in the surgical situation. For example, vitamin C has been shown to decrease the amount of analgesics that are needed after surgery. And so we wanted to utilize that benefit. A major consideration was to make this something that anesthesiologists would be comfortable with. Protein consumption has long been considered as a reason to cancel surgery, regardless of the amount or type. So rather than trying to go straight into using intact proteins for this, we decided to use amino acids to differentiate that this is not something that requires time for proteins to be broken down in the stomach. And we wanted patients to get maximal nutrition combined with safety and comfort for both the healthcare providers and for the patients. So future research in formulation would also include altering that to include some select intact proteins as well as the amino acids.
Thank you so much. And I appreciate your justification for many of the kinds of things you did with this supplement. So my next question, what would you say are 3 takeaway points from your study?
The first takeaway point that I find is that our stomachs empty liquids, even amino acid containing liquids, very quickly. So we found in our group that 57% of the participants' stomachs were empty enough to be considered safe for surgery by 30 minutes after drinking the supplement. And that safety means that their gastric antrum measured having no more than baseline residuals present that would normally be there in a fasting state. 93% were safe for surgery either at that 30-minute point or by 60 minutes. And I find that exciting that almost everyone emptied so quickly because it makes it so that we can feel more confident in giving this nutrition to patients before surgery. We had only one individual out of the 56 total that took a full 120 minutes to reach safe clearance levels. And we don't know what the reasons are for that particular individual, but recognizing that there are some people that do just empty slower. Most of the participants actually had their stomach measurements be smaller, and so demonstrating that they were even emptier than their fasting starting point. So those residuals that had been there overnight, those levels had been higher than the residuals remaining after consuming and emptying this beverage. So not only are we able to give better nutrition, we're also often making patients even safer by including a preoperative amino acid, carbohydrate, micronutrient containing beverage. My second takeaway is the fact that there weren't any demographic or other factors that adversely affected gastric emptying. This group included a few people taking GLP-1 agonists, some having surgery that day, so they were dealing with the anxiety and stress of something happening that day. There weren't differences in age, BMI, or sex. Some people did just take a little longer, some a little bit shorter amount of time to clear, but they were all within that 2-hour time frame. And again, most of them were substantially less. So I feel that means we can be confident in allowing and encouraging patients to drink nutrient-containing clear liquids up to that 2 hours before surgery. Then my third takeaway is that we have more work to do to help all healthcare providers as well as patients understand the benefits of optimizing nutrition around surgery. This isn't just preventing malnutrition, which of course is also vital. This is a chance to help people recover faster, potentially shorten hospital stays, and just generally feel better throughout that surgery process. Understanding that, for example, those 12 grams of amino acids as part of a preoperative supplement can be given safely is an important part of that, particularly when we understand that most people empty even faster, so there isn't a need to add further safety factors on top. But even as the processes used in the study can be potentially helpful, first was that everyone, even those who were on those GLP-1 agonists, had an empty stomach after just an overnight fast. So putting those individuals on clear liquids for 72 hours before surgery, like has been happening lately, is not necessary and definitely not helpful for their nutritional status. So we need to do some more work in that area to verify that this is going to be consistent and we can help those individuals gain better nutrition as well. Another thing to consider is just the tool of gastric ultrasound. Ultrasound isn't the gold standard for gastric emptying, which is scintigraphy, but it is very available at the bedside. So if there's a question of a patient's gastric emptying status, we should be measuring that rather than canceling surgery because they ate or drank something a few hours earlier. So this is an area where we can help optimize nutrition even further the more that we learn and share.
Excellent. Thank you so very much. Very, very nice summary of your article. So then finally, my last question, if we think about the RDN out there reading this article and then wanting to use some of your research, what advice would you give?
I would love to have the RDNs use this research to help break some of the hospital culture we tend to have that says that fasting longer for surgery is somehow better. I have seen situations, and I know many of you probably have as well, where nurses and physicians will look at a patient skeptically or even disapprovingly if they say they last drank clear liquids 2 hours before going through the preoperative discussion. And on the flip side, this great amount of approval and excitement if they say, oh, yeah, it's been 12 hours since I had anything to eat or drink. And that's even in facilities that profess to follow those ERAS protocols. And I think a lot of it is just the culture of habit and tradition. So sharing this information that can clearly show how quickly a multi-nutrient containing beverage clears the stomach can be helpful in both educating patients and fellow healthcare providers to normalize that we want better nutrition to be able to get those better perioperative outcomes.
Thank you so very much. Very, very helpful in terms of what RDNs might be using and talking to other health professionals about. Thank you so much for your work on this topic. Personally, I think it's going to be of great value to our JANT readership, and your work in this area is greatly appreciated. I think your article also has the potential to affect what practicing clinical dietitians are doing in this area. And for that, thank you so very much. And thank you. I appreciate your time today.
Thank you so much. I appreciate the opportunity and your time as well.